Good morning or afternoon, whatever time it is right now. My name is Laura Guerra-Cardus. I'm with the Children's Defense Fund, and I'm here to testify in support of ACA. The Children's Defense Fund has worked for over 10 years connecting uninsured Texas children with affordable health care coverage, and we are urging this committee to keep the very meaningful benefits in the ACA for children and young adults in mind as they make decisions. As many of you know, Texas has the highest rate of uninsured children for the 12th consecutive year in a row. The large majority of these children are Texas citizen children. We've actually done a good job in enrolling CHIP and Medicaid eligible children. That rate of uninsured for us has gone down, but where the uninsured rate is growing is in middle-income families who don't qualify for CHIP and Medicaid but simply cannot afford private health care coverage. Latest estimates are that family coverage for 1 year is $14,500. I looked up the median income for Texans, latest data before I came in here, and it shows that that cost is over 30% of a family's income before you take out taxes. So it actually represents a bigger portion of their income. My written testimony includes the number of reasons of why Texas has such a high rate of uninsured children, ranging from less businesses in Texas and almost anywhere else in the state offering health care coverage for employees and dependents, to the lack of options for these middle-income families. Just to illustrate, today a child on CHIP, when they turn 19 years old, many of them become uninsured because we don't have affordable coverage options for them. When parents get a salary increase that puts some dollars over the CHIP income limit, their children lose coverage. And we started hearing about 4 years ago of many stories of families asking for salary cuts, not accepting promotions, or staying in lower income jobs. So we've trapped many families that could potentially be making more money and providing more for their families into the Medicaid income limit. And healthcare reform can change this. Families can start making more money and not losing their children's health care coverage. Also, children would receive preventive care. They'd have a medical home, which would really help us tackle the very expensive chronic illnesses that are increasing in our child population. Diabetes type 2 epidemic in our child population is an epidemic. It is a financial crisis for our country. Also, foster care children, right now when they come out, they become uninsured. ACA would allow them to stay on Medicaid until they're 25 years old. Those are things that are coming, but we're all wanting to emphasize things that are in place right now, and ACA is already working and delivering for children and young adults. Insurance companies can no longer deny children for pre-existing conditions. Young adults can stay on their parents' insurance plan, and that's already helping 2.5 million young adults across the country, and tax credits are making it easier for families to get health coverage. So we strongly support these provisions and do not believe that they should be taken away from our children or blocked, the ones that are yet to be implemented, not only to reach our 1.2 million uninsured, but to improve the health care for children who already have health coverage. And I just wanted to make one note about preventive care, if I may, from the discussion earlier. I don't normally pull this card, but I did go to medical school. I have my medical degree, and I'm the odd duckling that is not practicing. But one thing that we learn and that they really hound into us is that there are many more things that we can screen for that we don't screen for. Choosing which preventive screenings are recommended for the larger population is a medical decision that is based on the cost-benefit analysis. If you screen 100 people, are you going to get enough of those that are positive to make it worthwhile for screening those 100 people? And are you catching the illness early enough so that you can change the course of the disease? If you're catching a bunch of people but you're not going to improve their quality of life, it's not worth to screen. So those screenings are things that the medical community recommends every one of us get, and I don't think any of us would want to deny those screenings to anybody. As people learn more about the Affordable Care Act, support for it grows. Texans are learning about this. You all received a letter today from Progress Texas.
Finish up, because
this is the last. Thank you.
Okay.
I appreciate it. Y'all received a letter today from Progress Texas with over 3,500 signatures of Texans that support the Affordable Care Act, and that number is growing every day. And I really appreciate your patience.
Well, we appreciate you being here. Any questions?